thank you everyone for joining today's virtual office hours with the Congressional Health Dashboard. As we wait for everyone to join in, I know we had a couple put in the chat where what organization they're representing and what district they're from. If you haven't yet, feel free to keep doing that and answer the poll in the meantime. My name is Dana. I am the research analyst here at the dashboard. And in today's session of the virtual office hours, we'll do a brief history of our dashboard, give you a site walkthrough, and then dive into some mental health data using the dashboard. And if you have any questions at any point, feel free to put that in the chat as well. At the very end of today's session, we'll do a live Q&A, at which point you'll be able to come off mute and I can answer any questions for you then. I'm also joined today by a few of my coworkers, so Hannah Wade, Samantha Breslin, and Callie Pastor, who will be helping me monitor the chat, answer any questions, and provide helpful links throughout today's session. All right, let's get started and dive right into it. Okay, so just to start with the brief history. So our dashboard was launched in January of 2023. As its first of a kind tool, our mission is to provide rigorous, accessible, and nonpartisan data on health and the conditions that affect health on a congressional district level. And we just wanted to address that challenge through our goal setting. So we really wanted to optimize on the power of data. So data in itself can't change policy, but it's certainly an important facet in doing so. It can illuminate challenges and assets in communities that have otherwise been hidden. It can also inform effective policy solutions, and it can hold leaders accountable, really bringing into question if they are living up to their commitments, priorities, and their responsibilities. And so building off of this success from the City Health Dashboard, the Congressional District Health Dashboard was developed by our team at NYU School of Medicine, Department of Population Health. And in partnership with the Robert Wood Johnson Foundation, the Bipartisan Policy Center, and the Center on Budget and Policy Priorities, we built this tool to be helpful for a wide audience. So really honing in on the elected officials and their staff, advocates, journalists, researchers, media, and the general public. Really anybody that has an interest on data, health-related data, and most specifically on a congressional district level. So what data do we provide? We provide 37 different measures of health that's divided into 5 different broader categories and domains. So the health outcomes domain, social and economic factors, health behaviors, physical environment, and clinical care. We draw our data from federal sources and other data sets that adhere to our rigorous standards of data collection and analysis. So some of those sources that you may know are the U.S. Census Bureau, the Centers for Disease Control and Prevention, and the Environmental Protection Agency. So you can also see that some of our data, we have breakdowns for on a demographic level, and that's indicated here with a asterisk. We also provide some of the metrics on a census tract or a neighborhood level, so more granular view of that data on that level. Our team is compiled of health policy experts, population health experts, epidemiologists, geospatial analysts, and specialists. And we really work to regularly update the site with new years of data, new measures, and any relevant policy resources that we may find as well. And as I mentioned a little bit before, our approach and our metric selection is starts with our national data sets and what's already available. We try and ensure that all of our methods have underlying the data that we collect and we have on our site adhere to the rigorous methods in their data collection. We also try and find metrics that are balanced well across our 5 overarching domains, reflects public health priorities, and are regularly updated so we can provide that timely data and really should have an accurate representation of health that is currently in the US and across the nation. And so that is some of our history. Now we're going to do a little bit of a walkthrough of our site and kind of show you the journey there. So let me just stop sharing and bring this back up. Can everybody see my screen? Good. Okay, great. Great, awesome. So our landing page just brings you right to it. You can explore health by finding your district through an address or a zip code. And if you are already familiar with a congressional district that you're in, you can go down here and select the specific one that you're interested in. So let's say I am going to search up the zip code of my workplace. So that would be out of New York State. You can click here and it'll bring you to the snapshot of the district. And it really just provides a great overview of the metrics and the estimates of the measures of health in the congressional district that you've selected. So we've organized them by the domain. We also list out the metric, the actual estimate, and also a comparison. One of the main themes of our site is to ensure that our data is really quickly understood and it's visual. So in this case, when we have a comparison, you can see we use a green circle to indicate instances where your congressional district estimate is going to be better than the comparison average. A yellow triangle will indicate instances where it's going to be just around the average of the comparison, and a red square will be for those instances where your estimate is going to be worse than the comparison. And down here, you can also filter by domain. So let's say you are someone who's interested specifically in education. You can look and see which will fall under that. So we'll select social and economic factors. And there it will bring up all of the measures that fall under that domain. So again, I'm someone who's interested in the education space. So I'll look at high school completion. All of the quick facts are there, but I kind of want to look at more of the measure and how it kind of falls as on a map. I'll click on this metric specifically, and it'll bring you to the metric map page for the district. At the very top, it gives you a very quick summary of that estimate and how it relates to the comparison of the US average here. And so something to highlight and note that our colors are going to be uniform across the site. So in any instance where you see a lighter color, that'll indicate a better outcome, and darker colors will indicate worse outcomes. So the blue triangle here, you can see where the US falls and the estimate there. The orange bar and the estimate for the district will be connected on the other end. Yeah, so then you can see navigate to the left side where you can kind of filter out and see different estimates of your interest. You can even change it by the metric time period, so a different year. You can also change the scale bar and the comparison value from the US average to the state values. So in this case, I want to look at how the congressional district compares to New York. So go ahead and select that, and very at the top, you'll see that it'll change the estimate and the values. So you can see how it compares on that state level. So now you see, we know how New York 12th compares on a national level. We see how New York 12th compares on a state level. But now I'm curious about how high school completion compares within the congressional district of my choice. So New York 12th. I'll select show census tracts here, and that will pop up all of the neighborhoods and the colors that fall under that metric. So you can see again, bringing back to that theme that lighter colors indicate better outcomes and darker colors indicate poorer outcomes. So the light colors, you can see there are specific areas that are doing a little bit better and some areas that could use some help. But yeah, that is another way to just view the data and understand and compare how high school completion compares across a variety of different geographies. So let's say I am all set with knowing those comparisons, but I kind of want to know how that really breaks down. I can scroll down here and go to the demographics breakdown page, and it'll bring me to the breakdown of how high school completion compares across sex and across race and ethnicity within the district. So again, just really getting into the specifics and the granular level data that we have on our site. But let's say now I have all this data, I have all this great information, and I want to do further analysis. You can go to our menu and actually access all of the data on our site. It'll bring you to a page for you to just fill out a short survey, but after that, you have free and complete access to all of our data. You can download it completely, all of it, or you can also download it by state once you get to that point. But that is all that I had for the site walkthrough. And I'll just take this time to pause and ask if anybody has any questions, or can address that now while I transition. All right, so if there's no questions, I will jump right back into the topic for today, and that is going to be mental health. Just bear with me while I share my screen again. Okay, great. Everyone can see my screen? Good. Great. All right, thanks everybody. So now let's get right into it. So May is Mental Health Awareness Month, and with that comes a great opportunity for us to kind of renew the attention to the mental health crisis in the nation. And as we try and understand the complexities of mental health within our nation, it's important to know the different socioeconomic, environmental, and systemic issues that really play a role in mental health overall. And so in an effort to really understand the unique needs of local communities, data for all of these and a variety of these areas that relate to mental health can really illuminate some trends that can be leveraged to drive some of that change. And so on our dashboard, we have a variety of mental health related metrics. You can see here that are highlighted in the green rectangle. So we have firearm suicides, of course, we have frequent mental distress, opioid overdose deaths, children in poverty, rent burden, unemployment, and uninsured. All of those measures are health related, and we really sought for a investigation really to see any potential relationships of the metrics that we have and try and see if there are anything that's noticeable. So as we dove into the data a little bit deeper, our team found some interesting observations with opioid overdose deaths and frequent mental distress. So you can see here that on this graph that each of these dots or triangles, I guess, kind of represent a different congressional district. And they're also coded by color of the region that they fall under. And so although there is a positive correlation here between opioid overdose deaths and frequent mental distress across regions in the country. And those are also more prominent in the Midwest and the Northeast regions. Sorry, jumped the gun a little bit, sorry. Okay. But yeah, so another way to look at mental health, and in the nation, we looked at the trends by district density, and specifically we zoned in on the firearm suicide rates. So in higher places, places with higher population density, there could be more health promoting resources like parks or community health clinics, higher paying jobs, things of that sort that can really help that community. On the other hand, places that have a lower population density tend to have a lack of some of those services that we talked about, leading to potentially even high transportation time and distances that people have to travel in order to receive the same resources in other ways. And so we can see here on this graph that we do a district density index that's goes from pure rural all the way down to pure urban. And we did this categorization back in 2022 to see that. So we can link you to the blog there to see what we did with the categories there. And so after doing some digging and investigating more, we found that firearm suicides tend to decrease as the district density increases. So in other words, the firearm suicides tend to be higher in the pure rural districts and lower in pure urban districts. And this pattern really holds across for all demographic groups, highlighting the fact that males in particular are 6 times more likely to die by firearm suicide than males in pure urban districts. And they also tend to die by firearm suicide more often than females across all districts of all densities. But yeah, so some of this was, we did an investigation on, and we actually submitted a blog, an article with our bridging partner, ICMA. So we can send that a link for anyone who is interested in learning more about some of that research that we've done. But other than that, that's all for today's session. So we've gone through the site, we've done a walkthrough of the site, and we've explored some of the data that we have using mental health. So now we can open the floor to questions. So you can feel free to take yourself off mute, and or raise your hand, and we can go through the chat as well and make sure that we didn't miss anything. Other than that, if you don't have any questions, you can subscribe to our newsletter through the QR code, and also there is going to be some of those useful links for you that you can connect with us through. And afterwards, I think you can be on the lookout for a follow-up email. We'll share the slides. We'll also share a recording of the presentation today. And there's also a feedback survey for you. So if you have an opportunity to go in, we always try and improve these sessions for our users. So if you have any thoughts or suggestions, feel free to do so there. But other than that, have a great rest of your day, everybody. Thank you so much for joining today's virtual office hours.